Today's discussion is aimed at giving you all the information you need so you fully understand the process going forward. So if you're watching this right now, it is because we think that the main cause of your neck and back pain is something called facet mediated pain. Now, facets are basically joints of the spine. They're like knuckles of the spine that run from the base of the skull all the way down to the pelvis, and they're a very common source of back pain. In the neck, they typically cause pain that radiates up the back of the neck and in the shoulder blades. And in the low back, it causes a similar pain pattern. So when you look at this diagram, you can see that certain facets refer pain up into the base of the skull, other facets radiate into the shoulder, but by far the most commonly involved facets are the C3-4, the C4-5, and C5-6 facet joints. If we switch over to the lumbar diagram, you can see that it's a much more diffuse pattern across the low back, down into the hips, and then the upper thighs. Now let's shift over to a model of the spine so you also get an idea of where we're going. So on the spine model, this is a facet joint right here. And this thing has a capsule around it, and the medial branch, the pain fiber, runs here and innervates this half of the joint and runs down and innervates the lower half of the joint. So we believe that this is one of the causes of your pain, and the way we're going to block this is by putting a little bit of numbing medication right here to block this joint and to block that joint. So to bring it all together, the facet joint is an extremely common cause of back pain or neck pain. We're going to block the pain fiber going to that joint. You're going to see how you do that day, especially, and maybe longer, but we want to see an 80% improvement in your pain, and we want you to test out what normally sets off that pain, whether it's bending, twisting, leaning back, but what we want to see is significant improvement with that. So let's go over some of the most commonly asked questions so that you have a full understanding of what you're going through and how we're trying to help you. So one of the most common questions we have is, why do you have to block this joint? Can't you see what's going on X-ray or MRI? And the answer is no. The joints of your spine don't show significant changes on X-ray until you're far down the line, until you've polished off the surface of that joint and you've got significant bone spurring. But many of us have pain actually starting in our 30s that is facet mediated. And because those facets refer pain in predictable ways, we can block those pain fibers, and then if you get relief, then we're establishing that the pain is coming from that joint. Next question we get is, why do you have to do 2 blocks? We have to do 2 blocks mainly because this is an insurance requirement, and there are some studies out there that say that if you just do 1 block, there's a high placebo with it. So to be 100% sure, or over 85% sure, we do an initial block, then we follow up and make sure you got 80% improvement. We do a second block, make sure we had similar results, and then we can move on to the radiofrequency ablation, which is where we actually ablate those pain fibers, and it gives you relief for a year to a year and a half. The next thing we get asked are, what are the risks with the procedure? This is an extremely safe procedure. Between the point of entry and the target is literally just skin, a little bit of muscle, and then we're putting the numbing medicine right on the pain fiber going to that joint. And we use a live X-ray so that we know exactly where we're going. So there's no way we can paralyze you, and there's no way we can cause any significant injury. So in summary, we think that your pain is coming from the facet joints. The facets refer pain in predictable ways. We're going to block the pain fibers of the joints that are affecting you, whether that's in the neck, the mid-back, or the low back. We really want you to focus on your relief that day especially, because this is local anesthetic and it'll wear off. You may get longer relief, but we really want to focus on that day, and hopefully when we follow up with you, you've had great relief of your pain.